So I'm Brennan Rozell. I'm doing an ankle injury on my patient. You have to do hops, history, observation, palpation, and special tests. I'm going to start with history. So I'm going to ask her if she's how she injured her ankle, when she injured her ankle, where she injured her ankle, was there immediate pain in her ankle, did it swell, did she ice her ankle after, did she continue to do physical activity on her ankle, has she injured her ankle before, what side of the ankle hurts, and that's it. Next is the observation. While she's standing, you look at the anterior view and you observe the alignment of the toes and the position of the foot in relation to the limb. Medial, you inspect the arches, if there's a high arch or a low arch, or excessive prominence of medial midfoot. And then the lateral view, inspect for ankle swelling or prominence of posterior calcaneus. Standing on toes, heel should move into varus, and then gait, equal stride length, foot position, and weight distribution. Foot should be within 0 to 20 degrees of external rotation when walking. Then you have your patient lie supine, and in an anterior view, you observe the toenails and look for bunions, hammer toes, claw toes, and the ability to spread the toes. So spread your toes. Okay. And look for ulcers between the toes. She's fine. And then you have your patient lay prone, look at the plantar surface, observe for plantar warts, calluses, and ulcerations. The P in hops is for palpation. So first we will palpate for the lateral and the medial malleolus. We kind of just palpate around the area, see if there's any tenderness or pain. And then you go to the posterior heel, palpate both sides of the Achilles tendon, both the lateral and the medial. And then the peroneal tendons, she'll evert her foot, and you can see right here, there's no tenderness or pain. And then she'll invert her foot for the anterior ankle, and she's good. And then plantar fascia, you will look under here for tenderness. If there's no tenderness or pain, she doesn't have plantar fascia. And then the sesamoid bone is under the first big toe, and you just look for tenderness. And then you palpate all the metatarsal phalangeal joints to see if there's any tenderness or pain there. And there's no tenderness or pain, so she is fine. Part of the palpation is range of motion tests. She'll dorsiflex, and you'll have a ganometer, and you'll measure this angle, and it should be 15 to 20 degrees. And then she will plantar flex, and it should be 40 to 50 degrees. And then she will invert her foot, and this angle right here should be 25 to 35 degrees. And then she will evert it, and it should be 20 to 25 degrees. Next, you have the muscle testing. You have to test for the posterior tibialis. So her foot's going to be in plantar flexion, and you're going to resist her to invert her foot. And then test for the anterior tibialis. She's still going to be in plantar flexion, but she's going to try and dorsiflex and invert the foot. And then she's going to be in plantar flexion still for the peroneus longus and brevis, and she's going to try and evert the foot. Okay, you're good. There's no pain anywhere in those. And then for the extensor hallucis longus and extensors, her ankle is going to be neutral, and she's going to try and flex or extend her toe, which she's not very good at. And then the flexor hallucis longus and flexors, her ankle's still going to be in neutral, and she's going to try and flex the toe. She's better at that one. And then the gastrocnemius, her ankle's going to be in dorsiflexion, and she's going to try and plantar flex it. The S in hops is for the special tests. The anterior drawer test, you test the stability of the anterior talofibular ligament. And then the apprehension test, you assess the anterior talofibular ligament with ankle stability. And then the varus stress test, you invert the foot. And then the valgus, you do the opposite. Then the metatarsal phalangeal stability, you dorsiflex or plantar flex the proximal phalanx. And then interdigital neuroma test, you just see if they have Morton's neuroma, and she's good. That was the HOPS procedure and an ankle assessment, and I'm Brennan Rozell.